Hello, my name is Farrah Christian, and today I'm going to be teaching my coworker Betsy about the top 10 ways to prevent peritonitis in our peritoneal dialysis patients. My strategy that I'm going to be using is humor. There are quite a bit of humorous stories that I have about peritoneal dialysis patients. And so I'll be sharing those through some different stories that I have, as well as some pictures throughout my PowerPoint presentation. Humor is good whenever you're teaching because it kind of breaks the monotony whenever you're teaching something that may not be that interesting, and it kind of helps emphasize key points. And it does kind of have to be used sparingly to be the most effective, because if you use humor too much, the students may not take you seriously. So enjoy my presentation. Thank you. I'm going to be training my coworker Betsy today on how to prevent peritonitis, and this is the top 10 ways to prevent peritonitis from happening. The first, number 10, is we have to have a clean environment. The patient's house must be in good repair. They have to have running water, electricity, and just general cleanliness. During the treatments, we have to restrict the airflow in the rooms. We cannot have any open doors or windows, and no fans or vents blowing on the treatment area. We cannot have any pets or kids in the room because they do carry germs. And we do ask the patients to bleach their shower heads weekly, because certain organisms can collect on the shower head, and when the patient takes a shower, it can go from the shower head to the patient's exit site and cause an exit site infection that can lead to peritonitis. So, if your patient's house looks like they could be on an episode of Hoarders, they're probably not going to be a good candidate for peritoneal dialysis. Number 2, the patients always have to wear their mask, and anyone in the room has to wear a mask as well. Wearing your mask is the first step in the treatment process, so they have to put their mask on before they do anything else. And it does have to fit over the nose and the mouth. A lot of patients try to shortcut it and just put it over their mouth. And they do have to use a new mask each time they do a treatment. Number 8 is hand washing. It's very important. They do have to wash their hands after they get their mask on. They have to do it whether their hands look dirty or not. They have to remove all their jewelry, of course, before they wash their hands. And we teach them proper hand washing technique, wetting the hands with soap or with water and then applying the soap. We ask them to lather for 1 minute and make sure that they get in between the fingernails, in between the fingers, under the fingernails. And then whenever they rinse their hands and dry with the paper towel, we ask that they turn off their sink with the paper towel. We do not want them to use dish rags to dry their hands, because they could be harboring bacteria. Number 7, do not use any damaged supplies, so we have them check their supplies before they start a treatment. There can't be any leaks in the bags. The dialysate fluid must be clear. If it's expired, they're supposed to throw it away, and if any sterile caps are missing, they also throw that away. Number 6 is, when in doubt, don't. If the patient touches the sterile end of the dialysate bag, which is right here, when they're making their exchange, if they accidentally touch it with their fingers or anything else, they do have to throw their bag away. They cannot proceed with treatment. And also, if they touch the sterile end of their catheter, a lot of times people will forget to clamp their catheter, and then they remove the cap and the solution goes everywhere and then they touch it, just not even thinking about it. If that's the case, they need to call their nurse, because if they proceed with an exchange, they're going to introduce germs into their peritoneum and it's going to cause peritonitis.
So what do you do with that? As a nurse, what do you do?
If that happens, we have them come in immediately and we'll change the transfer set. And sometimes, depending on the doctor, they'll want to do some IP antibiotics just prophylactically. Other doctors will prefer oral antibiotics just to cover them. So, yeah, anytime they contaminate that, we have to change the transfer set. Number 5, this should go without saying, but sometimes it doesn't. They do have to take a shower every day. I have had patients that say that they don't take a shower every day, maybe every other day. They are okay to take a shower with the catheter once the exit site is healed, which is about a month. We do ask that they leave their catheter taped to their abdomen so that it doesn't hang, because that can kind of irritate the exit site. And we ask that they use a separate washcloth to cleanse the exit site, and to use antibacterial soap. And then once they're out of the shower, they can use their gauze and their antiseptic to clean around it and put a new dressing on. And sometimes people don't even need a dressing if it's healed. They can go without. Number 4 is daily exit site care. It does have to be done every day. If it's in the summertime and they notice that they've been sweating a bunch, we might even have them do it twice a day. And we teach them the correct procedure for how to change their dressing, and they have to apply an antibiotic cream to the exit site. And exit site care is important because if they don't take care of their exit site and it gets infected, those bacteria can travel down the tunnel and into the peritoneum and cause peritonitis if it's untreated. Number 3 is no swimming. We tell the patients, do not swim in any rivers, lakes, or streams. They can't get in the hot tub. They're not allowed to take tub baths at home, because that can introduce nasty organisms into their exit site, and then it'll travel down the tunnel and they'll get peritonitis. The only exceptions is if they have their own private pool at their house and it's chlorinated, then they can do that, and some doctors are okay with swimming in the ocean. And they just have to perform their exit site care once they get out of the pool or the ocean. Number 2, make sure you go number 2. It's very important for our PD patients to make sure that they're not constipated. The reason is, if they get constipated, the organisms that are in our feces can seep through the lining of the intestine and into the peritoneum, and it will cause peritonitis. So we ask them to increase their fiber intake, and they can take Miralax every day to prevent constipation from happening. And it's easy to see whenever we do the culture if it's gram-negative or gram-positive where they got the peritonitis from, whether they contaminated or whether it came from inside. Number 1 rule, no redneck engineering. I've had a lot of patients who cannot remove their dressing, so they take a pair of scissors to cut it away, and they ended up cutting a hole in their catheter. And it was about ½ an inch away from their skin, and they were really close to having it surgically removed and having to have a new catheter put in. So no scissors around your catheter. I've had patients who have noticed a hole in their catheter and it's leaking. So I had one patient that used some electrical tape to tape it, and she thought that would just fix it. So we send home some hemostats with the patients, and we tell them if it does have a hole in it to clamp above where the hole is and call us, and we can repair the catheter. In most cases. Sometimes it has to be removed, but we can usually fix it. So, no duct tape, no extension cords. And that's basically it. Peritonitis is very serious. It can, if it happens enough, it can cause the patients to ruin their membrane, and it can't filter anymore, so they have to go back on hemo. So,
Wow.
that's it. Thank you, Betsy.
You're welcome.